Welcome to this video about an introduction to ADHD, part 4 of 4, interventions. What is an intervention? Within the SEND graduated approach, an intervention is a targeted and time-limited form of support, which is additional to class-based high-quality teaching and reasonable adjustments. That is, this support is additional to ADHD supportive classroom strategies, more personalised class-based differentiation, and the provision of ordinarily available equipment, resources and assessment modifications in regular lessons. Sometimes interventions can take place within regular lessons, reducing withdrawal time and maximising the opportunities for the pupil to transfer and link their knowledge and skills. Some interventions need to take place away from regular lessons and can be scheduled during school time or as part of the extended school day, for example, early mornings and in the afternoon. When do we need to consider putting in place interventions? If a pupil is not making good progress from their starting points and/or is at risk of not reaching their academic potential, despite adaptive strategies within high-quality teaching, it is time to consider putting in place one or more interventions. This is part of the assess, plan, do, review cycle. If the pupil has not been fully assessed and diagnosed with ADHD, it's important to evaluate the impact of any interventions provided to the pupil, alongside high-quality teaching, reasonable adjustments, and the provision of any additional equipment and resources, when exploring whether a profile of ADHD is likely. Triggers for considering putting in place interventions. It is important to ensure that you have the regular opportunity to scrutinise routinely available progress data for pupils with ADHD, with the use of robust data tracking tools and supported by pupil progress monitoring systems. The key aims of this work are to quickly pick up concerns around fairly small steps progress and to identify inconsistent profiles of performance. For a pupil with ADHD, concerns may be more prevalent in subjects where there are less opportunities for movement and a greater demand for activities requiring sustained mental effort. Additional sources of evidence include pupil work samples, specific assessment data, for example tests, behaviour and engagement data and information, and views provided by the pupil and their parents during meetings. Study skills support. Pupils with ADHD in upper key stage 2 and above can sometimes find it difficult to receive additional and explicit guidance to develop their study, learning to learn skills. This can cover, for example, understanding how they learn, organising their work, improving their memory, learning new information and researching, presenting their work, preparing for assessments and exams, and exam techniques. Study and homework after-school provision. Some pupils with ADHD can find homework and self-directed study and coursework a significant challenge. This can be due to a range of reasons which we've explored in earlier videos in this program, including difficulties with attention, concentration, and personal organisation skills. It can therefore be very beneficial to offer a study or homework provision in your school. This provision can simply provide a space for undertaking work with adult support when needed. It can also possibly include more structured sessions, which can model effective study habits, optional or extra interventions, and enrichment activities. Mentoring and coaching. Regular mentoring and coaching with a key member of staff, usually provided on a one-to-one basis, incorporates solution-focused approaches and makes use of targeted questions that they can use to prompt action. Goal setting. Short-term and very specific targets relating to areas of difficulty, plans of small action, and reviews and check-ins. This type of intervention sometimes includes incentives within contract systems. A mentor or coach might also coordinate opportunities for enrichment and mastery of skills, for example, creating opportunities for involvement in clubs and responsibilities in the school. Structured programs to support emotional and behavioural regulation. Time-limited programs that are structured or semi-structured usually involve the use of a program that has been bought or developed in the school. Usually this involves some use of physical materials. Programs that might be helpful for pupils with ADHD include teaching stress reduction strategies such as mindfulness, progressive muscle relaxation, and deep breathing. Teaching emotional awareness and self-regulation strategies. Developing concentration skills through playing games, for example dominoes, jigsaws, Jenga, chess, etc. Social skills programs which include turn-taking and managing potential conflict. And sensory circuits. Any programs like this should include regular opportunities for pupils to rehearse, practice, and apply their skills outside the intervention. Therapy. For a small percentage of pupils with ADHD, time-limited therapy provided by a qualified and registered counsellor or play therapist can be an appropriate and helpful additional support. Typically, this will be considered if other interventions are not having sufficient impact, where there are persistent and significant concerns that the pupil is experiencing emotional or mental health difficulties. This can include anxiety and low mood, for example. There are a wide range of therapy modalities. Some pupils, especially younger children, may be more appropriate for play-based therapy. Some pupils may respond well to solution-focused cognitive behavioural therapy, CBT, while others may find a less directive talking therapy more helpful. This depends on their age, life experiences, and preferences. Suggesting strategies to parents and carers. It is very important to work in effective partnership with the pupils' parents and carers to try to establish strategies which can apply both at home and at school. Sometimes it can be helpful to record and monitor this in the form of a home-school partnership plan, so that approaches between school and home are as consistent and complementary as possible. Examples include setting routines and expectations, tactical use of prompts and reminders, using visual aids, breaking down information and instructions, structuring time, access to clubs and activities, support with homework, incentive systems, etc. In some cases, a pupil and their parents or carers may benefit from more regular contact from at least one key member of school staff. If so, this should incorporate good news and tangible evidence of achievement wherever possible and in whatever form. Diet. Obviously, a healthy, balanced diet is important for all people. Pupils with ADHD sometimes find eating at school a challenge. This could be because they're not hungry, or because they want to prioritise their playtime. Some pupils eat just enough to take the edge off their hunger, so that they can go out to break, whereas others may have sensory issues relating to the smell, texture, or taste of foods. Hyperactivity can result in the body using up the energy obtained from food too quickly. Children should be encouraged to drink water during the school day, as being well hydrated is essential to aid concentration. School staff can help by encouraging children to eat and/or permitting them to go to the front of the queue at lunchtime. It is important to talk with parents about their child's diet across the day, including at home, and to keep parents informed if a child is not eating at school. Exercise. Research suggests that aerobic exercise can help reduce ADHD symptoms. Moderate to high intensity exercise can also improve cognitive functions. Does the pupil get plenty of exercise? Exercise in sports that include sessions of short duration with mixed activities are recommended. Exposure to outdoor activities is also helpful. Team sports and martial arts can also increase a pupil's executive functions and confidence, helping them work towards goals. Considering an ADHD assessment. If a pupil presents strongly and frequently with ADHD-type difficulties, both at school and home, plus school-based activities have been carried out to identify signs of ADHD, plus a range of appropriate class-based strategies have been implemented by teachers and teaching assistants, plus evidence-based intervention has been put in place and evaluated for impact, and the pupil is not making good progress from their starting points. At this stage of the SEN graduated approach, the school and all parents and carers should consider a full assessment. Referrals for ADHD assessment. There is no single definite test for ADHD and diagnosis. This requires a specialist medical assessment by a paediatrician or child and adolescent psychiatrist. If you think that the pupil may have ADHD, you are advised to first work with the pupil, their parents and carers, and staff to complete up-to-date basic screening and then more detailed screening. ADHD traits. This is a very basic initial checklist, which is a helpful starting point. And ADHD Vanderbilt assessment scales, a more detailed screener. Medical assessment. The doctor will take a history, obstetric, developmental, family history, psychosocial, etc., and will consider information from school and parents and carers about how the child and young person typically presents. A physical examination will be carried out. The doctor will also observe the child or young person in clinic and may undertake other tests. A child or young person may be diagnosed if the symptoms are pervasive across settings, cause significant difficulties and dysfunctions, and are not better explained by any alternative diagnosis. Diagnosis doesn't usually happen until after the age of 6. If ADHD is diagnosed, what might happen next? The National Institute of Clinical Excellence recommends that medication should not be the first line of management unless the child or young person is presenting with more severe symptoms, which are causing significant difficulties with their day-to-day functioning. NICE recommends an ADHD-focused group parent training program, environmental modifications, and interventions. We've discussed some of these possible interventions in this video. Parent courses. The New Forest Parenting Program is a short ADHD course for parents and carers which covers an introduction to living with ADHD, communication, scaffolding, play, feelings and emotions, and sleep issues. By attending this course, the parents and carers will understand ADHD and how it's affecting their child, recognise some of the causes of their child's behaviour, understand some of the difficulties experienced by their child, and improve their relationship with their child. Psychoeducation for the pupil. Psychoeducation involves providing information to the pupil about ADHD, including what it is, recognising symptoms, strengths and common difficulties, and how to manage ADHD effectively as part of day-to-day life in school and outside of school. There are various age-appropriate publications, including books, available to support this work with pupils. ADHD medication. Medication is not a cure for ADHD. NICE have produced national guidelines which recommend medication to be used in cases of severe or moderate ADHD where other approaches have not proved effective. Medications can be of two varieties: stimulant medications and non-stimulant medications. Non-stimulant medications can take up to several weeks before there is a noticeable benefit. Stimulant medications become active within an hour of ingestion. Some medications are taken before school and their effects should last for the whole school day. Other medications last for a short amount of time and will have to be taken during the school day. Medication is usually taken with food. Some pupils may experience a dry mouth and therefore may need to sip water from a water bottle. Effects and side effects of ADHD medication. ADHD medications work by increasing activity in the brain, particularly in areas that play a part in controlling attention and behaviour. Effects and side effects of medication are monitored at each medical appointment. Feedback is usually obtained from both parents and teachers. Height, weight and blood pressure will be monitored periodically. Side effects of ADHD medication vary from individual to individual, which can include suppressed appetite, headaches, stomach aches and nausea, delayed sleep onset, mood swings including feeling aggressive, irritable, depressed, anxious or tense. Managing and monitoring ADHD medication. Medication must be reviewed every 6 to 12 months as the child or young person is growing and developing. The prescribing doctor might change the type of medication and/or the dosage, for example, a gradual increase or decrease. A decision may be made at some point to also cease medication. The pupil's doctor will want to monitor not only their development and learning and whether their treatment is working, but also whether they are experiencing any side effects. The pupil's parents might give the school a monitoring sheet or booklet, or this may be requested directly by the doctor. It is also important to ensure that there is open and prompt communications with the pupil's parents or carers if there are any concerns about the medication, which may necessitate medical advice. This is the end of this video. You can view more videos on this channel in the About series.